Hello and welcome to Health Matters, coming to you on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Contrary to hopes and expectations, not every child is born with the common definition of normal faculties. Unfortunately, many live in denial of the condition because of the stigma attached to it. Autism spectrum disorder, also called ASD for short, is a group of conditions present from early childhood and identified by difficulty with verbal and non-verbal communication skills, among other things. Signs of it may be seen in early childhood, but autism is often not diagnosed until much later. According to the World Health Organization, 1 in 100 children has an autism spectrum disorder. My guest on the show is Chief Consultant Psychiatrist at the Federal Neuropsychiatric Hospital, Aro, Abeokuta, Ogun State, Dr. Aina Oyekomi. You are welcome to the show.
Thank you, Mary.
Okay, let me start off by asking you to educate us a bit about this spectrum. What's in this spectrum, and what do these disorders look like?
Okay, autism spectrum disorder refer to a group of conditions that manifest in early childhood. And as the word says, spectrum, it exists on a spectrum. So there are different conditions within the spectrum, and there are different severities or intensities of the symptoms also within the spectrum. So what happens in autism spectrum disorder is that there is abnormality in the development of the brain in early childhood. That is why they are called neurodevelopmental disorders. And within this, we have quite a lot of different disorders. So when we say autism spectrum, we now refer to the neurodevelopmental disorders that affect communication, social interaction, and behavior. So briefly, that is just what autism spectrum disorder means.
Is it true that autistic people are not in touch with their surroundings? That it's like they don't know what's going on the way the people we call normal do know what's going on around them?
That's not completely true. They just have a different way of perceiving the environment, and they have a different way of reacting or responding to the environment. They have unusual ways, of understanding what is going on around them. It doesn't mean that they don't understand. And then the degree of understanding would also depend on the intensity of the symptom. It will depend on which part of the spectrum the child is. For some children, their symptoms are very, very mild, that they can almost pass for a child who doesn't have any challenge. And for some, their degree of impairment is so much. So these children, will have different presentations. So it's not absolutely true that they are completely out of touch with what is going on around them.
What is the cause of this autism? Is it something that went wrong in pregnancy or something that happened to the mother?
Unfortunately, nobody really knows the cause. But there are some risk factors that have been found to be associated with the occurrence of ASD. They include things like genetics. So there are some genetical conditions that can increase the likelihood of a child having autism. For example, there's something called Fragile X syndrome. So if a child has this type of genetic abnormality, the child has a higher risk of having autism or of developing any ASD. Aside that, too, there are other genetic conditions, and people from families that have 1 or 2 persons who have autism also have a higher risk of developing autism, right? But research has shown that it is usually a combination of genetics and environmental factors. Environmental factors include things like the mother having maybe a viral infection during pregnancy, having maybe preterm delivery. So babies that are born premature have a higher risk of developing autism, than some toxins. But there is really no specific cause. They're just risk factors that can increase the probability that a child might have autism.
A moment ago, you were talking about symptoms of autism. How do we recognize autism? What shows up?
Yeah. Now, I must say that it's a spectrum condition, like we have said. Therefore, no two children with the same diagnosis might not present with exactly the same symptoms. So what you see depends on how intense the situation is in that child. Like I have said, it goes from the mild to the moderate to the severe type of ASD. But by and large, the areas that are affected are the same. They include the areas of communication, social interaction, and behavior. So in communication, a child with autism might not develop speech and language early. So you might find a 1.5-year-old boy who is saying nothing, or a 3-year-old girl whose vocabulary is not increasing. So maybe the child is only able to say one or two words. And sometimes when they can even speak, their speech might be very, very unusual. So a child with autism might be repeating phrases that he or she has heard before. A child with autism might even be repeating an entire dialogue. A child with autism might even be repeating the dialogue of his favorite, maybe cartoon character, or singing back a song in exactly the same tone as he has heard it. And then sometimes when you ask them questions, they might not respond in a particular way or in the usual way. Sometimes they might not even respond at all. And then you cannot hold conversation with them. And then the tone of their voice sometimes might just remain the same. So the usual inflections, the usual, up and down tone that when we are speaking, that usual rhythm is not there in children with autism. That's for communication. Then for social interaction, they might not have good eye contact. So they are talking to you and they are looking away. And you might have to be directing their gaze towards you actively. And then sometimes too, their facial expression might be just blank. You might not be able to read their emotions from their faces. Their body language, their gestures might not even match what they are feeling. So sometimes a child with autism is hurting himself and the child is laughing. Sometimes a child with autism might react in an opposite way to something that is happening in the environment. So maybe somebody is crying. A child with autism might not understand the emotions of that person. So a child with autism might not respond with the appropriate emotions expected of that child. Aside that too, the usual give and take of social interaction is lacking. So you smile at them, they are not smiling back at you. You expect them to play with you or to play with their peers, but they don't have this ability. So they usually don't have friends, because they cannot initiate friendship by themselves. And even when friendship is initiated, they cannot sustain it. So you find children with autism playing alone because their peers don't understand them. They might appear weird. And because they lack that give and take that usually occur in children playing together. So their peers might just be running away from them. Then apart from that, in their behavior, they have, this repetitive kind of behavior. And it could be, repeating something that has to do with their body. For example, a child with autism might just be flicking his fingers, might like to do this, or flapping the hand, or rocking to and fro this way, or even nodding, nodding repeatedly. So you might see them, moving in a particular way repeatedly. Sometimes they might be playing with an object, a particular object in the same way. So they might They might get maybe a Lego now, or Lego rather. You expect children to make blocks, to form different things with Lego. The child with autism might not do that. He might only be fascinated with just one piece of that Lego. And the child might like just to be spinning that piece around. And that is what interests the child. And if you attempt to take that away and replace with another toy, the child might just have a behavioral outburst. The child might get angry. So they have this insistence for the same thing. They don't like things to be changed in their schedule or in their environment. So they are so fixated upon their interests, and they have a narrow repertoire or a narrow range of behavior and interest. So what interests them?
Let me just cut in now. Of all the things you mentioned, I think the earliest thing that one can look out for is the smile, which usually we expect the child to have at 6 weeks. Does that mean that as early as that, you can begin to notice that there's something different about that child?
Yes, in the first year, if you're very observant, you would know that there's something wrong. So if a child does not coo or babble in the first year, it's a sign, it's a red flag. If a child does not smile back at you in the first 3 to 6 months, there's a problem. If a child does not look at you, when you call the name, or the child does not imitate you when you make some facial gestures, there's a problem. If a child does not anticipate your interaction, if a child does not anticipate your carriage, maybe you approach a child and you stretch out your arms, a child with I don't want to say a normal child now. So I want to say a child who doesn't have autism will be happy, would, stretch out the arms for the mom or another caregiver to carry him or her. So if these things are not there in the first year, then there's a problem. Or a child by the age of 16 months at most does not make any word, then there's a problem.
Okay, so you've mentioned that, there's a problem with speaking sometimes. I want to know if this autism can be managed and whether a nonverbal child can eventually speak.
Yes. Depending on the part of the spectrum where that child lies, a nonverbal child, ab initio, can make speech if intervention is instituted early. And a child with limited vocabulary too can improve tremendously if the right intervention is instituted early. And that is why we talk about early intervention, because you see, in the first 5 years, the brain is very, very immature and very pliable. So you get the best results when you intervene early and when you do the right type of intervention. So a non-verbal child can actually go on to be able to speak.
Okay, so 2 issues have been raised here. Let me take you back a bit. You mentioned genetics and environment as possible risk factors for autism. Is there anything that one can do or one can advise an expecting mother to do to prevent autism in the first place?
Well, what mothers can do is that just make sure that you go for regular antenatal care, you eat well, you rest well, you manage your stress level well, you don't allow yourself to be infected by anything, because at that time, you are carrying a life and everything you do would affect that child. And for mothers too, don't use drugs indiscriminately. Don't take drugs that are not prescribed by your doctors. If you have a headache, it doesn't mean that you should just go and start taking medication. See your doctor, especially in the first trimester when the organs are just forming. The first trimester is the most sensitive part of that pregnancy. So mothers must avoid anything that can have any untoward effect on the development of their child.
Okay, doctor, this is all getting really interesting. We'll take a short break, and when we return, we'll continue from there. Please stay with us. We're going on a short break. We'll be back after now. Welcome back to Health Matters on Channels Television. We're talking about autism, and we have Dr. Aino Oyekomi with us. Doctor, I'd like to ask you, concerning management, you spoke about early intervention. What does one actually do with a child that you can hardly communicate with, who is not cooperative? What kind of management, do you give such a child? And probably what part of it do you pass on to the parent to continue to manage the situation?
Yeah, though there is no cure, but the condition is very, very manageable. And the parents must know that they have the first therapist. A lot of times, parents want to pass the work to the therapist. Yes, the therapists are there just to show you the way, but your child spends the larger time of his life or her life with you. So the parents are first, they are their children's first teacher or first therapist. They must know this. Now, because the child is not talking, doesn't mean that you cannot still get into that child's life. It doesn't mean that you cannot teach that child. It just means that the child cannot learn in the usual traditional ways. So the second thing that parents must know is that they have to understand what the condition is all about, and they must be taught how to engage with these children, what to do. How do you make a non-verbal child to now become verbal? How do you make your child to look at you when you are talking? Because these are the basis for learning. If a child is not looking at you, the child cannot learn anything, right? So parents must learn how to engage their children, aside the fact that they must engage professional therapists also. And when I say professional therapists, I'm talking about the first place that you should start from is that if you are suspecting that there's something wrong with your child, see your doctor first. Do not do self-diagnosis. Don't do Google diagnosis. There are some conditions that might look like autism, and it's not autism. And that sometimes too, autism might not even be the only thing that the child has. There are some times that the child might have what we call comorbid conditions. So a child with autism might actually have things like maybe seizure disorder or attention deficit hyperactivity disorder. So this complicates the picture further. So do not do self-diagnosis or Google diagnosis. So professionals that would need to take care of your child include clinical psychologists. Clinical psychologists will teach you what we call behavioral management, how to engage your child, how to interact with that child, how to get the child to do something, how to teach your child. Educational psychologists too would intervene and let you know how to teach your child. Speech therapists, speech and language therapists would also be needed so that they can teach children, they can make these children speak. Occupational therapists are also part of the professionals needed here, because occupational therapists would help the child. They would teach the child how to be independent, how to do things by themselves, for themselves, how to groom themselves, how to eat unaided, how to clean their spaces, how to wear their clothes, how to take their bath, how to do, things that we call activities of daily living.
Okay, thank you so much, Dr. Oyekomi. As usual, you've taken us into the world of the patient, but our time is up. Thank you so much for coming on the show.
Thank you for having me, Mary.
And thank you there at home for being with us. Wherever you're watching, we enjoyed your company. Have a great day. I am Mary Alale Yusuf.